Hi everybody, you're welcome to event of this week. My name is EHEMT and today's topic is medical surgical nursing, or what is short form, med-surg nursing. At the beginning, I'm showing a video about the topic. In addition, I'm presenting my presentation. The final step is playing Kahoot. Okay, if you're ready, I'm starting with sharing the video. Okay.
You saw this patient, you bring them into the OR, you fix them, and you take them to recovery. I always like the immediate gratification of seeing somebody get better.
We do assessments, we do documentation, we administer medications, we do everything that all nurses do. We just have to do it in a very short amount of time.
I think the best part of my job is being able to be someone's lifeline. They're absolutely terrified prior to surgery, and being able to be that someone's everything, it just takes your breath away every time.
I've been an orthopedic surgeon for 20 years. Surgery is such a team sport. It's impossible for the team and therefore for the surgeon to be successful without having an outstanding operating nurse and circulating nurse.
They are that advocate, they're that healer, they're the educator. We really want nurses to explore a career in OR nursing because really the possibilities are endless.
That's one of the great things about Cleveland Clinic. You can be a circulating nurse one day and scrubbing in the afternoon. There's never any set pattern.
When you're circulating that day, you're trying to keep this room together, keep it on time, looking ahead to your next cases. You're running the show.
I really think that just being able to understand that you are part of the team and can be any part you want to be.
I came here to Cleveland Clinic. I said, I have no experience, and they said, that's fine. We have a perioperative program where we train you.
The orientation process in the OR is a full 6 months minimum. The first few weeks you are going through classrooms and learning the basic instruments, and then after that they actually get you right hands-on into the OR.
In the simulation OR, they have what you see in a real OR. It's the lights, the bedding, the equipment, learning just a simple gown and glove using a scrub scene.
The education team that actually guides us through our entire 6-month orientation really fights for you and makes sure that you learn everything.
They want you to be the best nurse possible here.
It's about integrity, it's about compassion, it's about innovation, it's about quality, and probably the most important value is teamwork. And for a nurse to live those values of the Cleveland Clinic really is the foundation for success of being an operating room nurse.
You can specialize in general surgery, or if you want to get more specific, like cardiothoracic or open heart surgery, we have a track for you. So from basic surgical procedures to doing face transplant, the opportunities are endless for an OR nurse here at the Cleveland Clinic.
I am the last calming force for the family and the patient before they roll into that OR. You're there to say, it's okay, I do this every day, and we're going to take the best care of you.
We take care of the sickest of the sick on patients from all over the country, all over the world. You learn so much and you have the power to change so many lives.
We have the finest staff in the country and in the world. We do the cases that no other hospital will touch. It's a very impressive, very humbling experience to work here with this caliber of people. And I think personally, I wouldn't want to be anywhere else.
I'm going on with my presentation. Okay. Medical surgical nursing is a nursing specialty area related to the care of adult patients in a broad range of settings. Medical surgical nursing is the largest group of professionals in the field of nursing. Advances in medicine and nursing have resulted in medical surgical nursing evolving into its own specialty. Many years ago, a majority of hospital nurses worked on wards and everyone was a medical surgical nurse. Today, licensed medical surgical nurses work in a variety of positions: inpatient clinics, emergency departments, HMOs administration, outpatient surgical centers, home health care, humanitarian relief work, ambulatory surgical care, and skilled nursing homes. Some military medical surgical nurses serve on battlefields. Question 1. Following surgery, the patient complains of mild incisional pain while performing deep breathing and coaching exercises. The nurse's best response would be: A. Pain will become less each day. B. This is a normal reaction after surgery. C. With a pillow, apply pressure against the incision. D. I will give you the pain medication the physician ordered. Answer is C. Explanation is: applying pressure against the incision with a pillow will help lessen the intra-abdominal pressure created by coaching, which causes tension on the incision that leads to pain. Question 2. A patient is in continuous pain from cancer that has metastasized to the bone. Pain medication provides little relief and he refuses to move. The nurse should plan to: A. Reassure him that the nurses will not hurt him. B. Let him perform his own activities of daily living. C. Handle him gently when assisting with required care. D. Complete AM care quickly as possible when necessary. Answer is C. Accused patients with cancer and bone metastases experience severe pain, especially when moving. Bone tumors weaken the bone to a point at which normal activities and even position change can lead to fracture. During nursing care, the patient needs to be supported and handled gently. Question 3. Nurse is teaching the patient regarding his permanent artificial pacemaker. Which information given by the nurse shows her knowledge deficient about the artificial cardiac pacemaker? A. Check the pulse rate once a day in the morning upon awakening. B. May be allowed to use electrical appliances. C. Have regular follow-up care. D. May engage in contact sports. Answer is D. Because the patient should be advised by the nurse to avoid contact sports. This will prevent trauma to the area of the pacemaker generator. Question 4. A student nurse is assigned to a patient who has a diagnosis of thrombophlebitis. Which action by this team member is most appropriate? A. Apply a heating pad to involved side. B. Elevate the patient's legs 19 degrees. C. Instruct the patient about the need for bed rest. D. Provide active range of motion exercises to both legs at least with every shift. Answer is C. Explanation is: instruct the patient about the need for bed rest. In a patient with thrombophlebitis, bed rest will prevent the displacement of the clot in the extremity, which can lead to pulmonary embolism. Question 5. A patient taking heparin sodium asks the nurse how the drug works. Which of the following points will the nurse include in the explanation to the patient? A. It dissolves existing thrombi. B. It prevents conversion of factors that are needed in the formation of clots. C. It inactivates thrombin that forms and dissolves existing thrombi. D. It steps in with vitamin K absorption. Answer is B. Explanation is it prevents conversion of factors that are needed in the formation of clots. Heparin is an anticoagulant. It prevents the conversion of prothrombin to thrombin. It doesn't dissolve a clot. Question 6. A patient is being evaluated for cancer of the colon. In preparing the patient for barium enema, the nurse should A. Give laxative the night before and a cleansing enema in the morning before the test. B. Render an oil retention enema and give laxative the night before. C. Instruct the patient to swallow 6 radiopic tablets the evening before the study. D. Place the patient on CPR a day before the study. Answer is A, because give laxative the night before and a cleansing enema in the morning before the test. Barium enema is the radiologic scanning of the colon using a dye. To obtain accurate results in this procedure, the bowels must be emptied of fecal materials, so the need for laxative and enema. Okay, I need that water. Okay, question 7. Days after abdominal surgery, the patient's wound dehisces. The safest nursing invention when this occurs is to A. Cover the wound with sterile salty dressing. B. Approximate the wound edges with tapes. C. Hydrate the wound with sterile salty. D. Hold the abdominal continence in place with a sterile gloved hand. Answer is A. Cover the wound with sterile salty dressing. Dehiscence is the partial or complete separation of the surgical wound edges. When this occurs, the patient is placed in low forward position and instructed to lie quietly. The wound should be covered to protect it from exposure, and the dressing must be sterile to protect it from infection and damp to prevent the dressing from sticking to the wound, which can disturb the bleeding process. Okay, question 8. Nurse is preparing her plan of care for her patient diagnosed with pneumonia. Which is the most appropriate nursing diagnosis for this patient? A. Fluid volume deficit. B. Decreased tissue perfusion. C. Impaired gas exchange. And D. Risk for infection. Answer is C. Because pneumonia, which is an infection, causes lobar consolidation, so impairing gas exchange between the alveoli and the blood. Because the patient would require adequate hydration, this makes him prone to fluid volume excess. Question 9. The nurse is attending a bridal shower for a friend when another guest, who happens to be a diabetic, starts to tremble and complains of dizziness. The next best action for the nurse to take is to A. Encourage the guest to eat some baked macaroni. B. Call the guest personal physician. C. Offer the guest a cup of coffee. D. Give the guest a glass of orange juice. Answer is D. Because in diabetic patients, the nurse should watch out for signs of hypoglycemia manifested by dizziness, weakness, pallor, diaphoresis, and tachycardia. When this occurs in a knowing patient, he should be given immediately carbohydrates in the form of fruit juice, hard candy, or honey. Question 10. What is the best reason for the nurse in instructing the patient to rotate injection sites for insulin? A. Lipodystrophy can result and is extremely painful. B. Poor rotation technique can cause superficial bleeding. C. Lipodystrophic areas can result causing erratic insulin absorption rates from this. D. Injection sites can never be reused. Answer is C. because lipodystrophy is the development of fibrofatty masses at the injection site caused by repeated use and injection site. Injecting insulin into these secreted areas can cause the insulin to be poorly absorbed and lead to irregular reactions. Question 11. After surgery, Gina returns from the recovery room with a nasogastric tube in place following a gallbladder surgery. She continues to complain of nausea. Which action would the nurse take? A. Call the physician immediately. B. Administer the prescribed antiemetic. C. Check the patency of the nasogastric tube for an obstruction. D. Change the patient's position. Answer is C. Explanation is nausea is one of the common complaints of a patient after receiving general anesthesia. But this complaint could be aggravated by gastric distension, especially in a patient who has undergone abdominal surgery. Insertion of the NGT helps relieve the problem. Checking on the patency of the NGT for any obstruction will help the nurse determine the cause of the problem and institute the necessary intervention. Question 12. A 56-year-old construction worker is brought to the hospital unknowing after falling from a 2-story building. When assessing the patient, the nurse will be most worried if the assessment relevant. A. Reactive pupils. B. A depressed fontanelle. C. Bleeding from ears. And D. An elevated temperature. Answer is C. The nurse needs to perform an exact assessment that could indicate alteration in cerebral function, increased intracranial pressures, fractures, and bleeding. Bleeding from the ears occurs only where the basal skull fractures that can easily contribute to increased intracranial pressure and brain herniation. The husband of a patient asks the nurse about protein-restricted diet ordered because of advanced liver disease. What statement by the nurse would best explain the purpose of the diet? A. The liver cannot rid the body of ammonia that is made by the breakdown of protein in the digestive system. B. The liver heals better with a high carbohydrate diet rather than protein. C. Most people have too much protein in their diets. The amount of this diet is better for liver healing. D. Because of portal hyperemesis, the blood flows around the liver and ammonia made from protein collects in the brain, causing hallucinations. Explanation is the largest, answer is A. Explanation is the largest source of ammonia is the enzymatic and bacterial digestion of dietary and blood proteins in the GL tract. A protein-limited diet will therefore decrease ammonia production. Question 14. Laboratory of a male patient with peptic ulcer yielded an elevated titer of Helicobacter pylori. Which of the following statements indicate an understanding of this data? A. Treatment will include ranitidine and antibiotics. B. No treatment is necessary at this time. C. These results indicates gastric cancer caused by the organism. D. Surgical treatment is necessary. Answer is A. One of the causes of peptic ulcer is Helicobacter pylori infection. It releases toxin that destroys the gastric and duodenal mucosa, which decreases the gastric epithelium's resistance to acid digestion. Giving antibiotics will control the infection, and ranitidine, which is a histamine 2 blocker, will reduce acid secretion that can lead to ulcer. The last question in the presentation is, during the first 24 hours after thyroid surgery, the nurse should include in her care? A. Checking the back and sides of the operative dressing. B. Supporting the heat during mild range of motion exercise. C. Encouraging the patient to ventilate her feelings about the surgery. D. Advising the patient that she can resume her normal activities immediately. Answer is A. Explanation is following surgery of the thyroid gland bleeding is a potential complication. This can best be assessed by checking the back and the side of the operative dressing, as the blood may flow towards the side and back, leaving the front dry and clear of drainage. Okay, everyone, thank you for your attention. Now we are going on with Kahoot. Okay. Okay, it's the over code. You can enter. I'm waiting. Okay, we can start it. Bone resorption is carried out by which of the following cells? Okay, that's the correct answer. The nurse needs to carefully assess the complaint of pain of the elderly because older people okay. Which of the statement by the patient to the nurse indicates a risk factor for CAD? Okay, correct answer is I smoke half pack of cigarettes per day. Which of the following would be inappropriate to include in a diabetic teaching plan? Okay, that's the correct answer. Included in the plan of care for the immediate post-gastroscopic period will be which one? What instructions should the patient be given before undergoing a paracentesis? The empty bladder before procedure is correct answer. Which of the drug of choice for pain controls the patient with acute pancreatitis? The patient has a good understanding of the means to reduce the chances of colon cancer when he states which one? That's the correct answer. Immediately after cholecystectomy, the nursing action that should assume the highest priority is which one? As the last. While salva maneuver can result in bradycardia, which of the following activities will not stimulate? Okay, it was the last correct answer. Who is winner? Okay, congratulations, Blue. Congratulations, Mohammed. Thanks all of you for your attention. Okay, thanks everyone for your attention. I hope you enjoyed it. Next Thursday we will meet again. Okay, see you. Bye bye.